I'm still waiting on an interpreter.
Okay.
Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County. And today I am solo to kind of go over some of the numbers related to schools and what we've been seeing. So first of all, over the weekend, I want to kind of share some community level metrics. So today we're reporting 63 new cases, but over the weekend we saw 119 cases over the last 2 days. So we're averaging about 60 new cases per day. Our total cases now in the county are 5,244. And the cases that we're reporting today are anywhere between the ages of 6 years and 79 years, showing that this is a disease that impacts both the young and the older age spectrums. Our positivity rate now is at 8% in our rolling 7-day average. And so I don't need to share what that means, that we are really going to have to take a look at some of the things that we're doing. We're reporting some new locations of concern: Morning Star Village, North Point Terrace, and Prairie View Assisted Living. While we have no additional deaths to report, we continue to monitor, and our recovery rate is at 96%. Both of our community-based testing sites are reporting increased volumes of testing, because that's been another question. We talk about how is positivity rate calculated, but that tells me and should indicate to all of us that more individuals are symptomatic and are out to get tests. And our 3 health systems continue to monitor their capacity. And while they have capacity, they remind all of us that staffing could be an issue at some time. So while we're considering and experiencing moderate community transmission, we put our schools and our businesses at risk. So today I wanted to share a little bit about where we are at schools. Some of the school districts in Winnebago County have been in session for 6 weeks. Our largest 2 districts have been in session for 2 weeks. Cases of COVID-19 have been reported in over 43 schools, and that's everywhere from our pre-K and 12 up to our universities. So no school level or grade has been spared in all of this. Total cases reported are 69 within the schools, 33 adults, and 36 children. But I want to put that in some context and perspective. Based on the Regional Office of Education, we have over 50,000 students in Winnebago County and over 5,000 teachers. So when you look at that, the numbers are small. So it talks about how well our schools have done, and especially the school nurses. I call them the guardians at the gate. They have been quick to identify potential cases. 1 symptom or more, they're sending children and staff home so that they can be tested, increasing the testing numbers, as well as obtaining an alternate diagnosis. And we believe that that protects our community as well as our school, because we can identify the infections earlier in the course. The number of individuals who have been quarantined, though, as a result of this, are 438. So for every single one of those cases, we've done a case investigation, identified who the close contacts were, and quarantined those individuals. The average age of the case is 26 years. And so if I were to tell you that who the super spreaders are, we know that that's the group has been the 20 to 29-year-olds. And some of the concerns regarding early childhood have not really borne out. And the median age is 19.4 years. So that means we've got equal numbers of cases above the age of 19 and below the age of 19 years. So what's been going well? Schools have prepared and made the necessary changes to prevent the transmission in schools. So while we've had cases associated with schools, they have not been transmitted in the schools. These are acquired infections outside of the school environment, detected in the school, and then appropriately quarantined. So that's why we are not getting the transmission at this time. But it does require all of us to be on board. The school children, I'm going to call them the little kiddos, have been doing a great job. And they've been supported by their families. They're wearing masks. They're staying home when they are sick. They're going to see their health care provider if the child has 1 symptom and the school nurse is calling them to come pick up their child and their siblings to go home until that child either has an alternate diagnosis or a negative COVID test. And they've been working to limit those exposures after school and on the weekends. So again, while we have cases in schools, Transmission has not occurred in the schools. The infections have been acquired outside of the school, which is why that community transmission rate is something we all have to own and we've got to work on. Now, the school personnel, I'm going to call them the adult kiddos, have not been following the guidance consistently. They needed to limit in-person meetings. They need to stay home when they are sick as well with one or more symptoms. And they need to avoid mixing the cohorts. Oftentimes we're having to quarantine more because if the teachers mix a cohort, and we've talked about this before, if I'm a teacher of 20 and you're a teacher of 20 and we combine our classes, if one exposure occurs, now we've got 40 children impacted versus just 20. Off-site school activities have also exposed both children and adults. The weekend getaways, the family gatherings, the social events, and the traveling sports teams and clubs. These are the kinds of activities that we need to be mindful of. We've talked about bringing back to in-person education, but it's the outside activities that are driving this infection in our community, and we need to be mindful of it. So, and the results have been increasing number of contacts. So one case generates a significant number of contacts. We've had increased number of classrooms quarantined, increased number of adult caregivers who must stay at home with the quarantined children. And ultimately, we've had the increased infections. It's also resulting in decreased stability for our paraprofessionals and support staff who rely on in-person education for their employment. If a school has to take what's called the adaptive pause or return to remote learning, that staff that relies on in-person then goes off and are furloughed. And so we have to be mindful that what we do impacts others. And of course, we ultimately talk about the increasing morbidity and increased risk of mortality. We have to be mindful of both. We need to keep our community to help keep our kids safe and our schools open. So a couple of reminders. You must quarantine while you're waiting for test results. I've heard people return back to environment and say, I got tested yesterday and I'm waiting for my test result. You must quarantine at home until your test results are received, because if that test result is positive, you will now expose people over that time frame. All school personnel have to be intentional, thoughtful, and follow the guidelines that the administration has put in place to keep the school environment as safe as possible. That means social distancing. That means cohorting, combining classrooms, or doing what they call the collaborative classroom model. This is not the year that we can be doing that. Wearing the face coverings when you're outside of your classroom in shared office space or classroom spaces. Reviewing the travel guidance. We put this out every Tuesday so that people can make plans accordingly. If you're traveling to an area where the infection rate is higher, think about what you are doing there to make sure that you do not bring the infection back, and back from the outside into our inside school environment. Staying home and following up with your school's COVID-19 team if you have one or more symptoms of COVID-19. Do not brush them off. Don't brush off that newly acquired headache, backache, stomach ache. All of those things can be signs and symptoms of COVID. This disease, as we have seen, as we've learned, and as it evolves, this pandemic, is a great imitator. It has lots of different symptoms. And parents and guardians must continue to be thoughtful and intentional and follow the guidelines. Think about your weekend getaways. Think about your family gatherings, the play groups, participation in traveling sports or private clubs, and social events such as birthday parties. I know it's hard. It's a pandemic. We're tired of it, but we are doing well at holding. But all of us in the community have to do our part so that people can stay safe in the in-school environment. I cannot tell you how hard it is to close schools and quarantine. Children need socialization, and any parent who's been doing remote learning with their children needs their children in school as well. It's a hard job being a remote teacher and a remote worker all at the same time. And we know that they struggle when remote learning is implemented. There are emotional and mental health impacts, and there are also economic impacts. We talked about the economic impacts on individuals who rely on schools for their employment, such as the aides, nutrition staff, custodial, bus drivers, office. I'm sure I've missed someone in that grouping, but everyone relies on the schools to be in session for those kinds of paras and support. And our business community relies on our school as well. They rely on our school to make sure that their workers can return to their work environment, that they have a place for their children to be. And it's disruptive to them as employers to have calls that come and say you have to pick up your child, or the next 2 weeks are going to be quarantined and then they're remote learning. And that parent then, or caregiver, is in remote. We've met with our representatives from restaurants and bars to consider what additional mitigation strategies we can put in place. And you can imagine they're not happy about that either, and who can blame them? We're moving now from 3 validated to 2 validated complaints. They want us to step up the enforcement activities on those individuals who may, and entities, we talked about those businesses that may be contributing to the spread. So in addition to the 3 that we reported last week, Choice Furniture has been issued a notice of non-compliance and will be posted on the website. So as we come through this, we have to remember, we say it over and over again, we are all in this pandemic together as a community. We're all in for 815, we're all in for Illinois. If this pandemic has not taught us that we are all interconnected and interrelated, it will be a hard message to get through. So whether you're a school, a daycare, a university, a business, from a small, locally owned to a large big box, bars and restaurants, if you're parks and recreation, if you're a sports club or sports organizer, if you manage arts and museums, if you are a place of worship, if you're a community center, if you're government, if you're a family, if you're an individual, we are all interdependent on each other to keep this infection spread low. So be intentional and be thoughtful. Wear your face coverings, maintain your social distancing, wash your hands, minimize your contacts, and remember to get your seasonal influenza vaccination. We can do this. We can keep our children safely learning in school, our businesses continue to thrive, and we can continue to maintain a high degree of safety in our community during this pandemic. And now I'm happy to take any questions.
Did you say there were 2 new businesses that were added to that list?
No, we are moving from 3 validated complaints down to 2 validated complaints. We are going to step up the enforcement at a much quicker pace based on recommendations from our business community. And then there's one addition, Choice Furniture was the newest business added. So we now have a total of 4 entities that are on the list.
Okay.
Can you talk a bit about, with a lot of these schools having to move to remote and that, what the impact is on, especially for younger kids and their families, in terms of daycare options and things like that for parents who are working?
So the question is, what is the impact to young families and daycare? Well, first of all, we've talked about if you get the notice tomorrow that we have to put you in remote learning, first of all, there's no daycare that's a quarantine daycare. So you're going to have to find someone who can quarantine with your child for that 2 weeks so that you can return to work. And in addition, whoever that person is going to have to help your child do the remote learning. And so that becomes, you have to make sure you're set up, that they can log into their classroom, if they're able to do whatever the assignments are. In addition, we talked about this emotional for children. There is a certain amount of fear if all of a sudden your teacher doesn't show up, or all of a sudden one of your classmates doesn't show up. We don't give out names, we don't share what that is, but children are perceptive. And we need to make sure that they have a routine and a consistency that we know that will take care of them during that time frame. And so that's why it becomes so destabilizing when we have to go into these remote learning abruptly because of a case that we need to quarantine a classroom in.
You mentioned early on when we were getting ready to start schools that we expected some positive cases, that they were going to happen. But this early on to the process for especially some of the RPS schools, was there kind of an expectation that we might have to quarantine classrooms this early on in the process?
The question is, did we expect it to quarantine this early? I think what was more surprising is the number of adults that have influenced and driven this. I think there was a big concern about children. We had read the information. There was some studies out that children were the super spreaders, right? That they had a tendency to have less illness, but more likely to spread. We did not expect as much community-acquired infection to be driving cases within the school environment. We anticipated there would be cases, and of course we anticipated that we would have to quarantine. We tried to keep those numbers low. We did not anticipate that cohorts would be broken. That would increase the number of children that would have to be impacted.
So I want to make sure I understand this. You're saying that there hasn't been spread in the schools, that it's been acquired in the community and throughout the schools.
Mm-hmm.
And that goes for the adults in the school as well?
Correct.
Because you also mentioned something about how they were having meetings that maybe they shouldn't have had.
Well, that's results in quarantine. So for instance, the question is for clarification. So let's say I'm a teacher and I come into the classroom and I have a positive case and I have a meeting with other teachers. I may be exposing them, right? So they become a close contact that require quarantine. Does that make sense, Jeff?
I think so.
Okay.
And they're having this meeting in person and maybe not.
It could be, and again, this might be a scenario that we're giving you some example of scenarios that might have occurred. It could be over the weekend, I am exposed. I may have a symptom or two. I come into the classroom environment. And we know that the nurses have been very good at getting the kids and the families, right? They screen everybody. But adults tend to rationalize symptoms, right? And I have to be clear that one or more symptoms in a school environment, we've said before, when in doubt, we keep you out until we can rule out COVID-19.
Can you go back really quick to, just to make sure I'm clear when you were talking about the daycare question, kind of looking at, so the student is required to quarantine. Is that parent then required to quarantine with them, or what is kind of the rule there?
Okay, quarantine is for the close contacts of a case. So they're required to stay home, not leave out of the home. A parent is a contact to a contact in that scenario. And so they can go to work, but they need to make sure there's someone at home to take care of the child. And they have to understand that if that quarantined individual were to become ill during that, anyone who cared for that child would then be a close contact. And so that's where some of our families, it's not the time to bring in your most vulnerable adult grandparent to help you with child care because they put themselves at risk. Because quarantines can turn to cases.
You mentioned the 8% moniker for positivity rate. So does that officially put us in the orange for 2 categories now?
We are in orange for 2 categories.
I ask you this every time we're talking about this.
I know.
And I'm just hoping that this kind of gets across to people. How close are we to seeing, things that we've been able to enjoy coming back in phase 4? How close are we to seeing those start to be pulled back?
And the question is, how close are we to moving back? Well, this is why we're working with our community right now about what can we do differently? What can we do to help drive that infection rate down a bit? We saw that our 2 areas, one of the areas that's Kankakee County and Will County, were able to bring their numbers back into alignment, and we're able to kind of roll back some of the mitigation strategies they had. We've pulled our, we looked at what had been done, what had been recommended by the governor's office and the different Illinois Department of Public Health. We know that bars and restaurants were very much the ones impacted, reducing capacity, social gatherings, and so we said, what can we do here? And again, our businesses also want to remind us, that one of the areas they want to make sure is that they have a safe and healthy workforce. So if people can't go out of their homes, if they can't enjoy an evening out because they're quarantined or they have to stay home with quarantined children, that does not bode well for business as well. So again, when we start to look at that, what can we do differently? And so one of the areas they asked us to do as a health department is to ramp up the enforcement, speed it up a bit, right, for the individual entities. Remember, we don't find individuals, we define entities, is to go out on the masking complaints. But I also want to, as you can see, there's no one big establishment that has been identified. We've talked about this. It's the family gatherings. It's the long weekend trip in which you traveled with a family that's not part of your household. And you think, well, we're under 50, right? There wasn't a whole big grouping. We knew each other. We'd known each other, but you haven't quarantined with each other or even been in regular contact with each other. And if one of that grouping now becomes positive, and it can be from an outside exposure, then you have multiple families that can be impacted. And those multiple families have multiple children in schools.
And just to confirm, I'm pretty sure I read on this, but the other quality of concern is the cases per 100,000, correct? That's the other one?
Correct.
Okay.
And so we are more than 50 per 100,000. So the last 3 days, you know, we've been at least 60 per 100,000. And so we're continuing to monitor that as well. So again, we have community transmission. We're at a moderate level. We believe that the school environment that we continue to see, because we're not having transmission, if I were to look at the positivity rate within the school, I gave you the number 63 over 43 cases, right? We're not at a high rate of positivity within the schools, but we've got to keep it that way, meaning for every family, do not send your child to school if they're ill. Think about what you're doing in your after-school hours. Is it really necessary to do a traveling baseball team or an event in Wisconsin or Iowa? Is it really necessary to have that birthday party when you bring in people from outside of our area to celebrate? I know that people want to get back to normal. I'd like to get back to normal. But we're in a pandemic, and so we have to do things a little differently. And I shouldn't say a little, a lot differently if we're going to get there. But we can do this. We can get through this. And we need to get through it if we want our businesses to survive, if we want our livelihoods to thrive, if we want our children to thrive.
You mentioned that this movement for non-compliance with businesses moving faster. Is that anything you can tell us more about in detail, or is this something that's still getting worked out?
No, I mean, we're working through it. I mean, they came back with some recommendations. We reached out to them, and we work with them on a regular basis. We put out our daily report. We don't want anyone to be surprised, oh, we're turning orange. Because again, as I've said before, everyone has a hand to play in this. Everyone can do something differently if they want us to help continue in the right direction. And so we reached out to them and said, look, we know that mitigation strategies throughout the state have been targeting bars, restaurants, social gatherings. What can we do to offer that as a way to start in the process? As well as they asked us to increase our enforcement activities. So instead of 3 violations validated moving before a notice of noncompliance, we are now going at 2 notices, noncompliance, and then moving it up the track faster.
And is there any update for the previous 3 businesses that were not entirely businesses, but the 3, I guess, organizations more or less that were put on the list the last time we spoke? Has there been any updates on their compliance? Are they back within compliance? What's kind of that schedule?
They are in their corrective action plan, and remember, some of them have up to 2 weeks. We say 1 incubation period to get it. Different for a school environment where they may have to get their school board together to adopt their new policies and codes and procedures. And then we have a follow-up schedule to go out there and view where they're at. And of course, if they've got additional complaints in that interim time frame, we will then also that will be brought forward. And so we will move them then, if they are not in compliance, then to an order of disperse.
Wasn't there the 8% positivity rate? I remember early on we were talking about that maybe having triggering some additional restrictions on schools or in the community. Has that changed, or does it need to have other complications in it?
So the question was, is the 8% really one of the only metrics that we look at? It's one of the metrics they look in terms of a region. So we have to be thoughtful about, while we are a big player in the region, that we might be driving the region to some of those enhanced mitigation strategies that you saw 2 other regions in the state move to. But for school transmission, you're looking not only at the positivity rate in the community, but the infection rates within the schools themselves, and do you have transmission within that? Now, our schools started out with strong mitigation, right? They went to masking, they had the policies in place, there's plexiglass. I mean, some of these schools you would not even recognize what a lunchroom looks like from when I went to school, and certainly even what maybe all of you would have seen years back with plexiglass around the desks, with desks spaced out, with, everyone in face covering, with gym class in your regular street clothes, in comfy clothes, but participating, with the idea being that our schools were upfront about preventing it from the very start. So their ability to walk that back or do anything more strenuous really has to result in the individual. So they are excluding anyone with one or more symptoms, which is part of the state exclusion criteria. And so we are following up on every single one of those. And I think to our community's credit and benefit, we are probably detecting infection much sooner as well, so that it presents the transmission into other businesses as well as within the school environment.
But I think essentially what you've been getting at for the majority of this press conference is that the community is going to make it continually more and more dangerous that we start seeing more and more cases pop up in schools.
Correct. And the question is, it's the purpose of today is to remind people that the community drives so many, right? I mean, this is not something that an individual business, an individual school, but it's our collective will and intent as individuals about how we live our lives, how we're going to prevent this disease in our community, and that the community has a tremendous amount of impact and pressure on those institutions. And if we want to keep our kids in school, if we want to keep our businesses open and thriving, we have got to really start to understand how we and our individual behaviors influence and impact the infection rate.
That 43, over 43, does that include private schools?
That includes private and public,
Pre-K through college.
pre-K through college.
How many schools do you know probably have, how many of those private schools?
We can get you the list, and we have that list, but there, I'm going to say, if you were looking at ratio of private to public, it depends upon how many schools are in each district. I mean, the publics include the charters as well as, and then we have
Are you
the.
listing these on your website? The schools?
No, we do not list them on the website. We can provide the list of schools because many of them have noticed, as you know, we work with them. First of all, our commitment has been we would notice with the school, with their families first, right? So we always notice the families most impacted first before we give it to the media. We typically do a media release then with that particular school so that they understand how many classrooms have been impacted. We're not going to identify which, we are never going to tell you the case or the contacts, the individuals to protect their identity, but we will be telling you how many classes and what groups are impacted.
You said it was 43 schools, correct?
Correct. And I understand from the regional office that they've got about 150, and they said they could get exact estimates between the public and the private. Anything else? Thank you for your attention. Have a great afternoon and do your part.